to go? Okay. Good morning, Queensland. Giving our COVID briefing update this morning, I can report that we have 6,596 new cases to report. 3,394 of those are rapid antigen test results. So again, I thank Queenslanders for continuing to register those results and encourage people to make sure that they're doing that in a timely way, and also to the parents who are also uploading that information around children and their positive results as well. We did 10,738 tests in the last 24 hours, and the number of positive children in the 5 to 17-year-old range is increasing. So we've seen an increase to 1,905 reported in the last 24 hours, and that's up from 1,587. But as far as the information I'm receiving, certainly from the Department of Education, is schools are still managing very well. There hasn't been a need to have any classes quarantining, or of course there's been no school closures, which is great news. So I want to thank all of our teachers and our education staff in public and private sector who are managing this so well. We know it's a challenging time, but we're all getting through this, which is great. Sadly, I'm reporting 12 deaths that have been reported in the last 24 hours, and we are still seeking to just get the vaccination status and ages of those individuals. So there's been some delay in that data this morning around those 12. 404 in our public hospitals, which is a decline, which is fantastic, and ICU we have 34 in our public ICU and 28 in our private hospitals currently, and our vaccination rates for 16 plus are now sitting at 92.4%, so it's great to see that still coming up, and 90.38% double dose, and our boosters are now at 62%. But I do want to encourage everyone to come forward who has not been vaccinated yet, particularly parents who have children between the ages of 5 and 15. I'd still like to see those vaccination rates much higher. Our 5 to 11-year-olds is still below 50%, and our 12 to 15-year-olds, we have not hit 70% double dose yet. So while we are seeing these numbers increase in children with positive cases, it would be really good to have parents coming out and getting those children vaccinated as quickly as possible. Of course, we have our vaccination clinics still operating across the state, no bookings required, and of course they can go to community pharmacies or see a GP. I'll now pass over to the Chief Health Officer. Thanks.
Thank you very much, Minister. As the Minister has said, we have 12 deaths to report today. As you have said on numerous occasions, these are 12 people who have died who have had a recently positive COVID test. That's a COVID test that has been positive around the time of their death. Although it is in this group of people, it's often very difficult to work out to what extent the virus has been a contributor to their death, because most of the people we are seeing are in the older age group with multiple other medical problems. There was some delay in the data this morning, so we don't have an age breakdown or vaccination status breakdown at this stage. In terms of the hospital situation continues to improve significantly. We're down to now 404 people in our public hospitals, down from 462 yesterday. So another dramatic decline in hospitalisations. As we know, intensive care admissions lag behind hospital admissions, because often patients spend a long time in intensive care if they do require intensive care. So we have 36 patients in intensive care, 20 of them ventilated. I think there were 34 yesterday. In private hospitals, we're down slightly to 28 patients in private hospitals, down from 29 yesterday. As the Minister has also said, we are seeing a bump in cases in children. We're up to 1,905 reports in the last 24 hours. That's up from 1,587 the day before. The numbers are not enormous. We had larger numbers only 2 or 3 weeks ago, and we have not seen increases in hospitalisations among children. To me, the bigger concern when children get infected is the risk to their parents and their grandparents, and that's why it is so critical that anyone coming in contact with children get their booster, any older person. In fact, any of us who have had our second dose of vaccine more than 3 months ago should receive that booster, because we really know it makes an enormous difference to your risk of having severe disease or being hospitalised. I will hand back to the Minister. Thank you.
Sorry, you talked about, you're not totally concerned about the bump at the schools. What
Yep.
about the overall
No, 6,596 today. 6,596 cases reported. What was that? 1,300. I'm sorry, I missed that.
5,200.
Yeah, it's up. So the total number is 6,000. Was that the number we gave? 6,596 today. It is a slight increase. I mean, that numbers fluctuate from day to day. I wouldn't read too much into fluctuations on a day-to-day basis. Well, I mean, the thing that is most useful, and I've said this a number of times, is looking at those hospitalisations, because that's a number that doesn't depend on people's behaviour. If people are sick, they go to hospital, and they're just inexorably declining. And that to me is the most useful measure of what is happening with this pandemic. Sorry, second. Sorry, I didn't quite hear you. I'm sorry.
Sorry. So the QFBS.
Oh, the fire service.
Yeah, sorry. Won't impose a vaccine mandate for staff and volunteers.
Well,
there've been discussions
look,
on it for a while and they've decided not to. Graham, do you think that's fair?
I think the fire everyone should be vaccinated. The fire service comes into contact with the public. They should be vaccinated against COVID-19. The decision about mandating is one for the fire service. We do not impose. Chief Health Officer has not imposed a mandate, for example, on the police. They have made that decision themselves. But firefighters should be vaccinated. The issue about mandate, I think that's an internal decision for the fire services. But I would like to see the firefighters vaccinated against COVID-19.
We were told you had the power to impose a mandate on firefighters. Or Jeanette Young and she decided against it.
I'm not aware of that. Generally speaking, the mandates that have imposed by the Chief Health Officer have been on invulnerable locations such as hospitals, nursing homes, prisons, schools. So on a particular profession, that's not, to my knowledge, something that has happened both through the Chief Health Officer's role.
You say they should be vaccinated. Should they be mandated?
I think that's a decision for the fire service. We are not. My opinion has not been asked. I think it's a decision for the fire service. I think. Look, I think any professional involved in dealing with the public should be vaccinated. I would like to think that firefighters are professionals like health workers, police, etc., and they should go out and get vaccinated. And I'm sure the majority are. We know the majority are.
What's your view just generally on mandates for vaccinations? Are you somewhat a proponent of?
I think the mandates are appropriate in the right location. I think our settings are correct as they stand. That we have mandates, for example, in aged care services, in healthcare settings, etc. I think the decision by the police to mandate it in the police force was a good decision. I think if used appropriately, they are of extreme value.
Does it seem a bit odd though that you've got QPS now mandating boosters, so they're mandating the third jab, and then QFBS is saying, well, we're not mandating anything? Is that a sort of strange divergence between the?
Look, I would like to see the firefighters vaccinated. So how they go about doing that, I think it's ultimately up to them. It is a little bit disappointing that if there are firefighters who aren't vaccinated, but I think we'll find the vast majority of firefighters will be vaccinated.
So you're saying the power lies with the
Look, to be honest, I don't know the legal power. I suspect I'm not certain. I think the Commissioner would have the legal power, but that's a legal question.
To the ABS put out a report yesterday about COVID deaths. Have you had a chance to have a look at that yet, or?
No, I'm not aware of that report. So, okay.
Yeah, I mean, it was just some analysis on COVID deaths in the country.
I haven't seen that.
The average death had 2.7 other illnesses with them. Is that sort of, I mean, I guess...
No, that doesn't surprise me at all. So what we've... The epidemic, the pandemic as we are seeing now is very different to the pandemic in 2021. It's a different disease. So I saw this disease overseas in 2021. These were young people getting a classic viral pneumonia and dying. What we're seeing now is very different because of vaccination. We're seeing much more complicated cases where you have older people, often with multiple medical problems, and often it's difficult to actually determine to what extent the virus is playing a part in their illness. It's a very different picture what we're seeing clinically in 2022 versus 1 and 2 years ago because of vaccination has completely changed the face of this disease. This disease is no longer like what we was seen in New York, in Italy, elsewhere in the early phases of the pandemic. So it doesn't surprise me at all that what we're seeing is that that most of the patients that are dying from COVID-19 have multiple comorbidities and are older.
Doctor, do you know how many of Queensland's elderly victims have been administered the facility midazolam?
No, I don't know anything about that. Midazolam is a sedative that is commonly used in palliative care. It's a very good drug that's used when you're treating someone at the end of life. So it's quite conceivable that it wouldn't surprise me at all if elderly patients with severe comorbidities and COVID might have been given midazolam as part of palliative care management. That could well be quite appropriate, but I can't comment specifically.
Can I ask you about some concerns about the state of the ED at Gold Coast University Hospital? Apparently, patient on Saturday night was waiting 8 hours. People are sleeping on the floor.
Yeah, and I've seen those reports overnight. I mean, the information I've received from the Gold Coast University Hospital is on Sunday evening there was an extraordinary amount of work, but particularly there was a number of life-threatening complex cases. So there were big teams working on those. And like always happens in our emergency departments, the teams always triage those waiting in ED to identify whether they're in life-threatening circumstances or whether they can wait. And obviously it doesn't matter what time you walk into an ED. If there are people who are in life-threatening situations, they will always prioritise those. And I understand they had a number of life-threatening cases on Sunday night where large clinical teams needed to work on those individuals. But I think, excuse me, I think what we're seeing in the ED and the story about the Gold Coast is a reflection of the fact that the people who walk into our emergency departments are there for a whole range of different reasons. And I've seen some of the reports around some of the evidence coming forward to the parliamentary committee on the primary and allied healthcare system, you know, whether it's people who are homeless, whether it's mental health, whether it's addiction, whether it's people coming in who are seriously unwell or seriously injured, but also people who are there simply because there are no other services at 3 o'clock in the morning, that they're coming to an emergency department instead. But they're coming for conditions that otherwise could be seen by a GP or could be managed outside of an emergency department. And that's why we're putting in place a whole range of initiatives to look at how we take pressure off the emergency department. That's what the parliamentary committee is about. How do we take pressure off the health system and redirect people who otherwise don't need to be in ED, who otherwise don't need to be in hospital beds, and even our announcement this week around satellite hospitals. It's about taking services out of our big hospitals that don't need to be situated in those buildings, that could be elsewhere in communities, that free up space for us to create overnight beds, which allows us to do more planned surgery, so elective surgery, and deal with emergency cases. So, yeah, this is just a reflection of the sorts of demands and our issues that our emergency departments face. But the report on the Gold Coast, I'm advised that Sunday night they had particularly critical life-saving cases, that clinical team. So it wasn't a case of beds. It wasn't that people were waiting in ED for that long because there were no beds in ED. There were beds available, but the clinical teams were concentrating on saving people's lives.
Minister, just on the Gold Coast, state government data indicates from July to November last year, with regards to ambulance response times, the patient was waiting 8 hours every month for an ambulance. Why isn't that situation improving?
Well, it is improving. The information I'm receiving everywhere I go in the state is we're starting to see pressure lifting off our paramedics. We're seeing the numbers go back down in our hospitals. So the news today, down to 404 public patients COVID related, is really helpful, and it is taking pressure off those health systems, remembering that we still have significant demand. You know, when COVID settles down, there'll still be COVID cases, and the Chief Health Officer and I had this discussion earlier this week. There will still be COVID patients in our hospitals for months and months, if not, in future years to come. So we'll still be managing them, but we're not going to be managing them in the numbers that we're seeing today. But the Gold Coast, we've put in place the triage, I guess some call it the tent, but it's a large space that's been set up. There's 2 triage facilities, one for COVID and one for our ambulance arrivals. The paramedics are telling me, when I saw them about 3-4 weeks ago at the Gold Coast Hospital, that is reducing lost time there by over 60%. So the new initiatives we're putting in place are making a difference. Co-responder, the new triaging model, having supervisor paramedics on site in the ED arrivals area for ambulances are making improvements.
There are claims that people are dying in the arms of loved ones while waiting for an ambulance. Are you aware of those claims?
We need to acknowledge that sadly, sometimes, no matter how quickly our ambulances arrive, some people are deceased at the time the ambulances arrive, or may pass away in the presence of the paramedics. It is really sad. The job of our paramedics is extremely tough. But in relation to claims of delays, those are always investigated where there is a claim that the person's death is directly contributed to a delay in ambulance arrivals. All of those things go to an internal review and also external reviews, often where there's certain circumstances around it. So, it's hard. I'm not going to talk about general statements about any one individual waiting a length of time. Our paramedics do an incredible job in making sure that they triage what are the most urgent cases and prioritise those cases. And our dispatch officers and our operational staff are doing that every minute of every day across the state to get ambulances to people as quickly as possible based on the status of their condition and how life-threatening it is.
So this might be one for the show, but is it almost time to reduce resources at the COVID referral centres at hospitals?
The COVID referral centres?
Dedicated to COVID arrivals?
You mean at the hospitals or? No, we're not there yet. No, we still have people coming in who are testing positive on a regular basis. We need to make sure that we're getting our numbers right down. We're off the peak, but we're still in this wave. We're not ready to pull away all of those initiatives, and in some cases, some of our initiatives will stay. As I've visited the hospitals, they have said to me, these initiatives are working so well, we hope they become legacy initiatives. We hope we retain these and embed them in the hospital system. And that includes virtual hospital in the home wards. I walk into hospitals now and I'll see a room full of clinicians on the phone, not visiting hospital beds, they're on the phone actually supporting people in their home. Instead of them needing to come in an ambulance, instead of having to come into ED, instead of being in a hospital bed, they're being managed in the home. And every hospital I go to, they say this is making such a difference and easing pressure off our hospitals. We've had telehealth, we've had hospital in the home for some time now, but the community's really embraced this now, and we've taken this to a new level because of COVID, that I think this is an initiative that will stay. And I hope we can build on, which will take pressure off our hospital system. Thanks, everyone.
Miss, if I can just one more.
Yep.
2022 and moving forward, what guarantee can you give to Queenslanders that an ambulance will be there on time when they need it?
Look, we are doing everything we can to improve the Queensland ambulance system, but remembering the Queensland ambulance system is responsive based on our hospital system. So, if ambulances are sitting in emergency department bays and not being on the road, that is because there is delays through emergency department and hospital beds. So we're concentrating on every step of the way, not just, we're of course putting more paramedics on the road, we're putting more ambulances on the road, we're building more stations, but we're also building hospitals, we're building satellite hospitals, we're investing in new initiatives in the hospitals to create those activities and those opportunities within the hospital system to create extra beds. So it's not just about building new beds, it's about opening up opportunities for existing beds, and we are putting all those initiatives in place that will improve the response time of ambulances. But can I say that's why we have two inquiries going on right now in Parliament. We have a parliamentary inquiry into primary and allied healthcare, because what happens in the private sector, what happens outside of hospitals, has a direct impact, an absolute direct impact on our hospital system. And also what happens in the mental health space, and what we do around better supports in the community around mental health has a direct impact in our hospital system. So we will continue to invest, we will continue to develop new innovative initiatives that help improve the health system. But I will say right now, and I've been saying it for 12 months as the health system, we cannot do this alone. We need to work with the Commonwealth, we need improved funding, we need matched funding, and we need the Commonwealth investing more in primary and allied health care and aged care and disability for us to ease pressures off our public hospitals. Because if we fail in all of those areas, they all end up in our public hospitals, and it's the states who are left to carry the weight of all of these issues. So I'll continue to talk to the Health Minister and to the Commonwealth to ask them to do their fair share as well. Thanks, everyone.
Growing your hair, I see.
So